Good morning and welcome to Our Chicago. I'm Tanya Babich. Every 2 seconds, someone in the U.S. needs blood or platelets, sometimes both. That's according to the American Red Cross. More than 38,000 blood donations are needed each day, and each of those donations can potentially save up to 3 lives. But with just over a third of the U.S. population eligible to give blood, making all of those numbers work is sometimes very difficult. Joining me now to talk about the need for blood, who it helps in the upcoming Great Chicago Blood Drive are Celena, the CEO of the Illinois Red Cross, and Lyric Porter, a blood donation recipient. Welcome to you both. It's good to see you.
It's good to see you. Thank you.
Celena, the American Red Cross is facing historically low blood supply levels. Talk us through the reasons for that. I know it's not just one reason.
Yes, Tanya, we are seeing some of the lowest levels for blood donation that we have seen in 10 years, just historic levels across the country. And so one of the primary reasons we know that is happening is because of the coronavirus pandemic and individuals who have been sick and no longer able to donate. And then we also just during the winter months, because we already see flu and other types of illnesses, people are not able to donate. So we know that traumas, accidents, injuries, patients who have critical needs, all of that continues regardless of the fact that there's a pandemic. And so it's, again, one of the many reasons that are contributing to the shortage.
Earlier this year, Celena, when we had the Delta variant first come out, that also caused a slowing in donations. Has the Omicron variant had a similar effect?
It has. And so we understand during a pandemic, blood donation is not front of mind for individuals when you think of everything else that is going on in your world, whether it's, remote learning of your children, your jobs, possibly your own health, the health of your families. And so now even more so with this variant, more and more individuals are also becoming ill and is also contributing to the shortage.
Lyric, you're here for a very important reason, to put a face to those who need these blood donations. Can you tell me a little bit about your health and about why blood donations are so important to people like you?
Yes, absolutely. So first and foremost, I have sickle cell anemia, and that is actually a chronic blood disorder. And so I actually rely on blood transfusions about every 3 to 4 weeks right now. But they are actually very extensive blood transfusions where they're called blood exchange transfusions. And in those procedures, I receive anywhere from 6 to 8 units of blood at a time. And right now, this is just important to me because to be transparent as possible, it affects my livelihood. And so not only does it affect my livelihood, but it affects the livelihood of, my family and friends as well, because if I'm not feeling well, then they kind of cater their needs to me, and they might not plan to take that trip they have been wanting to take because they know that I'm ill, and I might not be able to attend because my hemoglobin is low, or I haven't received any blood lately, so my energy might be down, or I might be at a higher risk for having more pain crises.
And so, Lyric, when you hear Celena talk to me about the shortage of blood donations, what goes through your head knowing that you need this blood to survive?
It's a very, very scary and nerve-wracking feeling, just because I know that in the past I've had very traumatic experiences with pain, and the only thing that kind of assisted along with the pain medication that I was getting were the blood transfusions. So just thinking of the idea that in the future, I might have to start limiting the amount of blood that I get so that it's able to be spread across the other recipients that need blood, or the other people with medical conditions. Someone like me who is living with a chronic blood disorder every day, they might kind of get pushed a little further down the line because it's not as immediate as the other people who are needing this blood.
Well, for somebody who already lives with a disease, that fear has to be very heavy on your shoulders. Celena, Lyric has done a great job of explaining to us one of the ways in which, or some of the ways in which patient care can be affected by a blood shortage. How else might it be affected?
And that's absolutely right. Typically, the American Red Cross has a 5-day supply on hand, and we're looking at approximately a 1-day supply. So Lyric is describing how a sickle cell patient, who again can be in incredible pain if they're not receiving a transfusion, but we also know that there are patients who are going through cancer treatment, or as she also describes, someone that's been in a terrible car accident or have another trauma, and they may be in the hospital, and if the blood is not there, they might not be receiving that life-saving help that comes from a blood donation.
Celena and Lyric, thank you. We're going to be back with more of our discussion after a short break.
Blood is needed now more than ever.
Join Eyewitness News and the American Red Cross for the ABC7 Great Chicago Blood Drive, January 12th and 13th.
At one of 5 area locations.
Sign up now at ABC7.